Good evening and thanks for joining us. Up first tonight, we start with an alarming trend. A rising number of inmates have died while in MCSO custody. It's a number that's been steadily increasing. It's important to point out that many of these deaths were drug-related. Some were suicide and some were accidental overdoses, which brings up another very important question. How are these drugs, in most cases fentanyl, getting into MCSO jails in the first place? Is it a lack of oversight? Is it understaffing? In some of these cases, MCSO deputies and the sheriff are handcuffed by the Fourth Amendment of the Constitution, which protects people from unreasonable searches by the government. In other words, they can't perform body cavity searches to look for these drugs without reasonable cause. In the last 8 weeks, 12 News has profiled the families of 3 men who each died in custody.
I'm sorry, I love you. When he died, part of me died too.
Families at a loss.
Why didn't I go get him immediately? Why didn't I save him?
Their sons, fathers, and brothers taken to jail.
He made some bad decisions. That's not who he was.
3 men considered innocent until proven guilty, dying in custody.
Nobody's perfect and we do make mistakes, but he didn't deserve to die.
Each awaiting trial.
Is something that really needs to be addressed. There's a problem with the system.
I'm sorry to loved ones who have lost family members in our jail system for any reason.
Their families demanding answers.
Was this avoidable? Could he have been saved? Could something have been done?
You know, there's more people that this happens to that they can get answers to.
There's nothing that will bring my son back. But if there's anything I could do that would make a difference for anyone else, we want that to happen.
Now for some background on how serious these issues are. We've received numbers from both the Maricopa County Sheriff's Office and the Medical Examiner detailing the number of inmates who've died in custody between 2020 and today. But the Sheriff's Office, addressing the issue today, is reporting even higher numbers than the Medical Examiner, meaning we're still waiting on additional records. But here are some numbers to consider. At least 95 inmates have died in the custody of the Maricopa County Sheriff's Department since 2020. That's according to the Sheriff's Office and the Medical Examiner. Since 2020, nearly 90% of the inmates who died were male and ranged in age from 19 to 90. Suicides, homicides, and drug-related deaths all increased over the last 3 years. And so here we are. In America, it's estimated that 136 people die each and every day from an opioid-related death. So in some ways, what's happening in our prisons is a reflection of what's happening on our streets. But here's the big difference. There's an assumption that while awaiting trial or while serving time, an inmate, guilty or not, should not be exposed to drugs, much less die. The reality is, there's always been some contraband in jails. But we're talking about a lot of drugs smuggled in. Chase Golightly has been tracking these deaths, and while it may be hard to feel compassion for the criminal Chase, it shouldn't be hard to acknowledge the pain that their families feel when their loved one dies in custody.
Well, Mark, these families aren't denying what their loved ones are accused of, especially when drugs are involved, and say just because they are behind bars doesn't mean they deserve to die there. Earlier today, I spoke with another family who saw a story we did last week about this and tell me a similar situation happened to their son. In Armida Quezada's Phoenix home, a memorial for her son, Arnulfo Quezada.
All I could say, he was my best friend.
Remembering the unbreakable bond they shared as mother and son.
Through good times, bad times. But one thing he did, he had a heart in helping others. That's one thing I will never forget.
The same goes for his sister, Alexis.
He was always goofy, so he liked spending time with his kids.
But just 2 months ago, his family learned Quezada died while in custody of the Maricopa County Sheriff's Office.
It just raged me. I couldn't sleep.
30-year-old Quezada spent months waiting for his trial while behind bars. He was charged with drug possession and burglary. Then in early February, they say Quezada was found unconscious in his cell and taken to Banner University Hospital.
So he was put on a ventilator and he wasn't breathing or anything on his own.
The family learning 3 days later when sheriff's deputies showed up to Armida's home.
And my heart just dropped.
Armida says the detectives told her where Quezada was and that she needed to see him that day, that he wasn't going to make it.
It wasn't fitting and it made us really angry.
Then 2 days later, Quezada died. His family thinking they were alone.
That is until they saw our story last week about 20-year-old Sam Fagan, his parents telling 12 News their son was in MCSO custody when he died.
When we seen the information about Sam, it was really gut-wrenching because he was younger than our brother.
And I just seen how young he was, so I understood the mother's pain because I still can't get over it.
Just like the Fagan family, the Quezadas want more answers about what happened in the jail.
The fact that it's been 2 months and we still don't have closure or answers as to what really happened it's really aggravating to us because even though we want to move forward, we can't.
Now, we've covered 4 families within the past 2 months who all tell us they're waiting on information from the jail, like video or a report, and whether anything could have changed to save their loved ones, Mark.
Chase, I want to ask you, we know that based on the information we've been given by the sheriff's office, drugs are the largest factor at play here. So just how serious is the drug problem in jails right now?
Well, based on the numbers we've received, it's severe and is only getting worse, Mark. MCSO provided the number of fentanyl pills that have been seized in jail since 2020, and you can see just how much that has spiked. And already this year, we're on pace to surpass 2022, which was a record high year. And Mark, the sheriff's office provided some pictures of the drugs they've seized, and you can see what people are trying to smuggle in through these jails. Pills smuggled inside a battery, even inside a bullet cartridge, as you can see here, and even in the lining of a face mask. And most troubling to the sheriff are people who are smuggling drugs in body cavities, where deputies aren't legally allowed to search based on the Constitution. Again, these photos show a glimpse of the massive amount of narcotics. And as I mentioned, most fentanyl that are being smuggled is seized at the jails. And the sheriff also shared how much work deputies are doing to try and limit overdoses. They've increased training so that nearly 2,000 staff members can administer Narcan, and already this year, again, on pace to surpass the number of inmates who received Narcan. But Mark, while drugs are a big factor, suicides are up, even homicides are up. Drugs alone don't tell the whole story in this, and families really want to see changes in how quickly and how much information they're getting.
All right, Chase, thanks. Sheriff Paul Penzone was supposed to be on with us tonight, but canceled, and instead held a press conference today to address the alarming spike in drug-related deaths. He did take questions, including the drug problems, and addressing head-on whether he can give more information, including reports and videos to families. Here's what he said.
So when it comes to the video related to the loss of life, that's something that I could absolutely be more expeditious with and more respectful to the family. I don't want to cause them more pain or harm, but if they feel that's something that helps them understand what occurred, then that responsibility is mine. And oftentimes the questions are, well, what is MCSO doing about this? My response is everything reasonable, possible, and within our powers. But that does not mean that we are miracle workers and that we can offset what is the most, I hope that you quote me on this, the most devastating aspect, the most challenging problem that we have in society and in our nation today is drug addiction, drug abuse, and primarily led by fentanyl. It is the most highly addictive, most highly dangerous, and it takes lives every day in our streets, in our schools, in our homes, and in our jails.
Another big issue is staffing. Despite the fact that MCSO has been offering better pay, they are alarmingly understaffed. And while the jail population is up, it's a dangerous and sometimes deadly combination.
Prior to COVID, we had 30 vacancies in the detention side of the house. And when completely filled, it's about 2,200 employees. We had 30 vacancies. Right now, we have over 600. Before COVID, after COVID.
There's the old saying, we've all heard it. You do the crime, you do the time. But there's also a reasonable expectation that inmates shouldn't be dying from overdoses in custody, either awaiting trial or serving time. And while the families wind up being the collateral damage when they get that call that their loved one has died in custody.
I'm sorry to loved ones who have lost family members in our jail system for any reason. Drug addiction, suicide, violent crime, health issues, whatever it may be. That is a loved one. And it's a void you can never replace. And I'm sorry for your suffering. But if we are going to address and solve this problem, You will not solve it from inside the jails out. We will solve it by prioritizing as a nation the fact that we have the most threatening chemical dependency that's ever faced our nation, and it is destroying all lives, not just young lives. But it's time for us to stop pointing fingers and start looking in the mirror. I'm looking in the mirror to see what I can do in the sheriff's office to improve.
I wanted to mention that last week I had a chance to tour the MCSO jail. It is a dangerously understaffed, like many companies, police forces, hospitals, and more. It's a dangerous place. The jail is suffering from a workforce that never came back after the pandemic. Part of it is because, as I saw firsthand, the jail is a very, very tough place to work. It's dangerous, it's thankless, and it takes a real toll on its workers, mentally and physically. There's also the issue of other police agencies across the county dumping their inmates in MCSO facilities, which only adds to the overcrowding problem. As these inmates wait to be processed, they sit in what amounts to a waiting room. I saw some of these men and women dealing with an opioid withdrawal. Some were laying on the floor, either unconscious or unable or unwilling to move. Some were laying in their own vomit. But remember, the Constitution prevents body cavity searches without reasonable cause, and even the scanners, which they have, can't pick up drugs if they're hidden inside the body. Understaffing, overcrowding, and the inability to search, drugs flowing over the border, all of those factors in a deadly conundrum. It shouldn't be unreasonable in 2023 to demand that our inmates, whether guilty or not, be protected while in our prisons. And until the numbers of judges and deputies and all of the other people it takes to run a jail in one of the largest counties in the country is where it should be, sadly, this is going to continue. And there will be more stories of heartbreak and unnecessary death.